All right, I'm living proof that you can take the teacher out of the classroom, but you can't make her shut up. So I had to take the teacher part with me. All right, this is a big-ass jet. If you're on one of these, you are really going someplace with 415 of your new best friends. And when one of these things crashes, you hear about it. Finger pointing, chaos, massive loss of life, demand for answers. You may wonder what this has to do with pharmacy or prescription drug abuse. And this is it. In 2010, more people died from prescription drug overdoses than if a fully loaded 747 had crashed every week for a year. Where's the hand-wringing? Where's the outrage? Why don't we want answers? You may say, okay, that's sad, but junkies are going to kill themselves. What am I going to do about it? And I use the word junkies purposefully here. It's convenient. It's an us versus them word. They're the junkies, we're the good people. All right, this is what got me fired up. On the right are my talented, smart, beautiful girls, and on the left is a man with a gun in the pharmacy. Those are my two worlds, home and work. They really don't go well together in that context. Quick disclaimer, I'm not anti-prescription drug. First of all, that would be silly. It feeds my family, it pays the bills. And used properly, prescription drugs are an important part of medical treatment for millions of Americans. But back to the junkies, that's what I'm here to talk about. You have a solid picture of what a junkie looks like, right? Okay. Remember, they're the junkies, we're the good guys. But sometimes junkies look like this. I hate updating this slide, but beautiful, talented people keep killing themselves in front of the whole world. Why didn't someone tell them that junkies are stupid and ugly and they're supposed to die where no one sees them? Frankly, most of the junkies I deal with every day look like me, and they look like you. So how about moving away from the us and them of junkies and recognizing that they are us? They're our parents, our kids, our neighbors, they're our coworkers, and they're sick and scared and willing to do terrible things, but they are us and they need help. Okay, woman, I'm not an idiot. I don't abuse drugs, I'm a good parent, I trust my doctor and my pharmacist. They wouldn't let me take anything dangerous. I got this. Great. But remember that time you had that procedure and the doctor wrote your prescription and it worked really, really well and you felt great and you didn't use it all? And then your friend hurt herself and she needed some and you gave it to her. This next slide for this one. Yeah, okay. So you gave that to her. It's not legal. Okay, that may be the least of your concerns. It's a violation of federal law. The sticker's there for a reason. But it's also a part of the problem. A bigger part of the problem is that we don't know what we've got. We don't know what's in the medicine cabinet. Chances are you have or have had one of these in your medicine cabinet. In fact, most ADHD drugs are classified as having the same potential for addiction as oxycodone. All right, we usually tally statistics using deaths because dead addicts are in fact sexier than living, breathing addicts. But if you look at it in terms of deaths, for every death there are 825 medical users. If you extrapolate out to those 22,000 plus deaths from the 747, you've got 18,150,000 people affected. Does it matter yet? No. We've got better than 18 million lives affected, more than 22,000 junkies dead a year, and a house full of potentially deadly but legal drugs. And some of you still don't see what the big deal is about. You're ready for me to shut up, but I still got 2 minutes. So this is for the cynics. Prescription drug abuse costs you money. Even if you're not a user, it costs you money. It costs you money in your insurance premiums, in your income taxes. If you're an employer, it costs you money in your payroll. Total cost is better than $122 billion every year. All right, we've talked about the problem at the national level, and it's big. More people die in this country from accidental overdose than die in car accidents now. And in Maryland, admissions related to opioid analgesic admissions, that's Oxy and his friends, were up 106% between 2007 and 2010, and we are overachieving in Wicomico County. We are up 223%. So, we have a problem, and I can stomp my foot and yell about it all day long, and in fact I do, but I need your help. We need to stop shutting up. Don't shut up at home. Our silence is deafening, and our kids hear it, and our partners hear it, and our parents hear it. Our silence is screaming, it's not my problem. I don't want to make waves. Don't shut up in our community. Addiction is a disease, and it's a public health crisis. Be prepared to be ignored or worse, but shutting up to be polite has the potential to be deadly. So you may not be ready to stop shutting up yet. You may not be ready to be loud, but take a small step first. If you do have these drugs in your house, old drugs that you're not using for pain, anxiety, or ADHD, get rid of them. It's really easy. So start here. Local police stations have drop boxes. In public spaces, you can walk in, drop those drugs off, and walk away. There's no paperwork, there's no interview, it's easy, and it's a first step to getting it out of your house and out of your medicine cabinet, where people may be looking for it already. So this prescription for this epidemic has to be community-based. A public health crisis requires the public to be involved in the solution. So please, step up, don't shut up. We need us.